Welcome back to West Texas View.
Good.
Welcome back to the West Texas View. I'm Johnny Lou Avery, and Daniel Marsh and Laurie Phillips are from the West Texas VA Health Systems. We all call it the VA Hospital in Big Spring. And before the break, Laurie was talking about the healthcare system, and one of the really interesting things that you said just after we turned off the cameras was that you've been doing a lot of telehealth. Tell me about that.
We do. Well, Mr. Marsh spoke about the rural nature of our system as a whole and how we really are working to bring the care to the veteran so that the veteran doesn't have the inconvenience of having to travel to us. And one of the ways that we've been doing this for some years now, in fact 8 years with the nutrition program, is through telehealth. And what we do is the dietitians are located at the Big Spring campus, but we're able to serve veterans at all of our community-based outpatient clinics, such as Odessa Clinic in San Angelo and Abilene and Hobbs, through the telemedicine unit. So the dietitian is in Big Spring and the patient can be in Hobbs, and they sit and they communicate over a computer screen.
It's almost like I'm Skyping my daughter. Right, Skyping the dietitian at the VA hospital.
And so we've really had success with that program, and we're kind of on the forefront of doing that. We offer other services via that means too, such as mental health and social work services, and really that's just the tip of the iceberg. We're really looking at expanding the types of telehealth that we provide throughout our system. We're looking at providing more primary care type services, or even some specialty care like dermatology or cardiology, where we may be able to connect with the Albuquerque system or the Amarillo system and provide services to the patients at their clinic where the doctor might be at a totally separate location.
And in this rural area, that is so important. And Daniel, the VA hospital has always been at the forefront of cutting-edge technology and other things that then filters down into the other health care facilities and communities. But tell us some, this doc in a box thing has always been a real interest to me, but also tell some of the other future things on the agenda.
Okay. We had a contract with our local hospital to do MRI studies, and we have been successful in getting approved for a mobile MRI unit, which we have now put in the Big Spring campus. We're seeing anywhere from 5 to 8 patients a day in that MRI right there in our main facility, which is a great plus. We're expecting that our workload is going to be so good that it's going to generate enough interest and enough support that we hope we can eventually build a permanent facility to house a new MRI unit there that will be housed in the new facility. The telehealth piece and the telemental health piece is really opening up all sorts of new avenues for our providers and for giving care to our patients as close to where they live as possible. And what it will do as we get these units installed is it'll give the physicians a chance to listen to the patient's heartbeat, to look at, for example, skin lesions if they've got something they need to have looked at. If a patient has gone, for example, to Albuquerque and had surgery, they don't need to go back to Albuquerque to have the stitches removed. They can come into our facility or to a clinic close to their location. They can look at those stitches, and the surgeon in Albuquerque can say, yes, those look okay, you can go ahead and take them out. They don't need to go back to Albuquerque and make that 431-mile trip to have that done. So it's going to save the patients a lot of inconvenience and a lot of time.
And you keep saying inconvenience, but for a lot of them, it's not an inconvenience. They just don't have the capacity to get there. They don't have a way to get there.
True.
Or they don't, they're at the age and stage where it's very difficult.
They can't make that trip, yes. And so we work with them on those cases. We're also very, very interested, and we've submitted a request to create a mobile telehealth van that we can take around to various parts of our catchment area, and we can stop there and we can give veterans screenings for diabetes, for blood pressure.
For shots.
For shots.
Flu shots.
We've been very successful in getting our veterans inoculated against both the regular seasonal flu as well as the new H1N1, and we've gotten very good support on that from our veterans, and it just helps give them a much better quality of life, and it helps protect them against these kinds of diseases.
How much do you work with your veterans organizations like VFW and American Legion?
Very, very closely.
VA
We have several veterans organizations that help support some of our transportation network. They go out and help us buy vans, for example.
Yeah.
And that has really helped the veterans get in to see our facility. If they need to come to Big Spring, the transportation problem goes away. And we're very supportive of those. We've also bought a couple of vans that we have, one now in Abilene and one down in San Angelo. The service organizations get the volunteer drivers. We sign them up as volunteers in our system. They do all the driving. We pay for all the expenses. We own the vans, but they get all the credit for all the workload. So it's a real win-win for all of us, and we have very strong support from our service organizations. Quite frankly, we couldn't ask for a better group of service organizations than we have here in West Texas.
And I know especially the DAV has been so helpful with that very thing, making sure that the disabled veterans certainly did not miss some health care needs because they didn't have a way to get to and from. I also remember a few years ago when we began to get an influx of female patients, and all of a sudden a lot of changes had to be made. Well, what percentage now do you have between female and male? Is it about 25-75 or?
Our female veteran population right now, the number that we've actually served is around 1,250 in that ballpark. The irony of that is that Texas has the fastest growing population of female veterans in the country. And of course, a lot of these female veterans are coming out of the Iraq and Afghanistan wars. We are getting prepared for that. We have a female veterans program coordinator. She's very proactive and very aggressive in making sure that female veterans get the care they need. We've made a substantial number of modifications in our facilities, not only at West Texas and Big Spring, but also in our different community-based outpatient clinics. We have given our providers some specialized training on taking care of females so that they feel comfortable doing that, and also to ensure that the females get the best care possible.
And a lot of times that's totally different than what a male patient would need from the standpoint of just the kinds of chronic illnesses they have, as well as just the normal everyday differences. We're going to have to take a break, and we'll come back for our final segment in this program about the VA health system. Be sure and write down the number and the information scrolling across the screen so that you can get in touch with either of these two people if you have questions or some of your friends and loved ones do later. We'll be back in just a minute for our final segment.
Stay tuned. West Texas View will be right back.